Hi, I'm Dr. Hughes, and I'm a holistic chiropractor and a functional medicine practitioner here in Columbia, Tennessee. And if you're watching this video, this is going to be the first of a series of videos that we're going to be sending out talking about the various ways that we look at a thyroid patient differently. We see a lot of thyroid patients in our office, and we have a very high success rate in both getting them to feel better, but then also making positive functional changes in their body. So these series of emails are going to kind of give you some little success secrets and clues as far as how we're able to do that. Now, one of the first success secrets that we utilize, or the first things we really utilize to evaluate people, is looking at lab tests the right way. Lab tests are extremely important when it comes to evaluating both thyroid conditions or any other type of chronic condition. And it's all about how you're looking at these labs. Now, for most of you with thyroid problems, you've probably had the typical thyroid stimulating hormone, your TSH levels checked maybe on a regular basis, every 3 to 4 months, every 6 months. And typically, if you've been on Thyroid for a while, your doctor is saying, okay, well, your TSH levels are normal, they're looking good, so no need to change anything, no need to do anything different. Now, that's fine if you're feeling great and there's no problems. But for many of you out there, there's probably a lot going on as far as you're still feeling really bad. You still have those same old fatigue, hair falling out, insomnia type thyroid symptoms, even though your lab tests are coming back normal, or at least your TSH is. Well, the reason that is because your doctors, when they run these tests, they're comparing you with basically the typical lab range. And as far as your TSH, that lab range, as far as what they're comparing you to, is typically between 0.5 and 5.0. So if you fall anywhere in between those numbers, which are very broad, wide numbers, they're going to say you're normal. However, when you're looking at your body from a functional or optimal standpoint, as far as narrowing down those numbers, your body works best when your TSH falls between 1.8 and 3.0. So that's a much more narrow range, but that's where your body is going to function the best. That's why so many people can come back from their test and maybe their TSH is say a 4.2. Well, your typical medical doctor is going to look at that and say, okay, everything's fine, but from an optimal or functional standpoint, you're not functioning at your highest level. Therefore, the various same old symptoms can start to manifest again. So looking at these lab ranges from a very specific standpoint, as far as narrowing down the ranges, as well as broadening what actual tests you're doing. Most doctors just tend to run the TSH, if you're lucky, a T4, and that's it. They can disregard the free T3s, free T4s, thyroid binding globulin, other types of thyroid antibodies, because essentially it's not going to change what they're going to do as far as just giving you some type of thyroid hormone or something like that. So it's very helpful to take a step back and narrow down those functional ranges to compare your test to, as well as expanding what labs you're actually looking at. Because once you expand that out, you get a much more clear picture as far as what exactly is going on, and more importantly, maybe why your thyroid isn't working like it's supposed to begin with, which is another question that's usually rarely asked. But it's the type of question that we have to ask if we're going to get you better. So I hope that makes sense. I hope you learned something new today, and that maybe shed some light on maybe why you want to take a closer look at the lab ranges in order to really successfully figure out what's going on with your thyroid and why you're still dealing with the same old thyroid symptoms. Anyway, I'm Dr. Hughes. If you have any questions, feel free to give our office a call or check us out at columbiathyroidrelief.com. Thanks a lot and have a great day.